Hey guys, today I will introduce you this machine, HIFU, to do the face lifting especially. Now I have the patient lying on the bed. Firstly, we must clean the face, then draw the face lines, to make sure the treatment will be totally done. So you must know that on the bones around the eyes, you can't do the treatment with 4D treatment head. So we must draw the map, touch the bone, and make the lines. When you are going directly near the ears, you must leave about 1 or 2 centimeters to do the treatment, to make sure that the treatment will be totally safe. And then this is the bone line, so it's better to do it a little higher, upper than the bone line. Okay. Then because the 4D treatment head, the real treatment area is about 25 millimeter per. The width is 11 centimeter. So you must spot the area about 25, like this, or 11. Let me put it. And then 25, like this. So about the area that you can't do the treatment with 4D line, like around the eyes. Okay, you must draw it to about 1 centimeter under the eyes. Okay, this part can do the treatment with V-marks treatment head, this little treatment head around the eyes, around the nose. Okay, but this part we can't do the treatment, so make edges. And here make edges. This treatment part, normally we don't do the treatment, but if the people has this wrinkle, nasobugan, you can do the treatment too. Okay. If the people who just start to do the treatment with this machine, you'd better prepare regular, I don't know how to say it, to meet every time to measure 25 and 11, 25, 11, to make the treatment better. Okay. Right. On the forehead, you can do like this. There is a vessel of the blood, so you'd better do the treatment on the forehead with V marks 1.5 centimeter depth. Okay. People who has a wrinkle between the two eyeballs can do the treatment with IMAX 2, 25. But the forehead, you can see that it's not a plain surface, so on this part, you'd better do the treatment with VMAX 2. Okay. It's easy. Okay. For the neck, we can't do the treatment on the phalange, where the air into the body. Can't do it. These two parts, you can see that there's a very obvious vessels also of the blood. Maybe you can see this. I'll try. Wait a minute. And the double chin. This person, it has not double chin, but for the people who has double chin, you can do the treatment. Like this, too. Okay, this, do the treatment with VMAX 2. VMAX. Okay, hold on. So, then I will introduce you the interface of 4D lines. You can see that there are 4 parts on the screen. This part is a picture where, which will help you, will teach you where to do the treatment with this cartridge, because different cartridge has different depths shown on the cartridge. You can see that for 4.5 for the layer of SMAS, 3.0 for the layer of dermis, and 1.5 for the layer of superdermis. We must know that 4.5, it just can do the treatment on the cheek. 3.0, technically we can do the treatment on the whole face, but on the forehead and around the eyes, the skin is very thin, so if you do the treatment with 3.0, maybe will make the patient feel a lot of pain. So it depends. 1.5 can do the treatment on the whole face. Okay. And then on the right corner, the right upper corner, you can see that the information of the cartridge, depth 3.0. Depth 3.0. It must be correctly the same. Use line, total line. Total line is the life of the use life of the cartridge. In total, the cartridge on this machine has a life of 20,000 lines. So it means that after you shot all these 20,000 lines out, the cartridge will have no use. It will be dead. Okay. The use line is the rest line or the rest life of this cartridge. Now we can still have 20,055 lines to do the treatment with this cartridge. Round number and point. It has the meter with the length with the parameter, the length and the pitch that you set. We have known that the length and the width is the real treatment area of this cartridge. This part, the length is 25, the maximum, and the width is 11 millimeter. Pitch and clearance. So, firstly, let's see the clearance. When we change the clearance, you can see that the round number won't change, but the point is reduced. So you can see, we know that the clearance, it means the distance between two lines, two points on the same line, because you see that the round number is the same. It won't change with the clearance, but the number of points will be changed when we change the clearance. So the clearance is the distance between two lines on the two dots, 2 points on the same line. So clearance, the distance between the points on the same line. Now we want to change the clearance. We change the pitch. You can see that the mainly changed is the round number. So the pitch is the distance between two lines. Okay? When we change the pitch or when we change the clearance, the round number and the point will be changed. So the largest lines and the points is 20 lines and 300 points. It's the most points that we can shoot by one time. The last parameter, power, it's very easy. It means the energy of the ultrasound. And on the right corner, on the right lower corner, you can see that there is a patient total. It means how many lines that you have used for the actual patient. When come here another patient and you need to start another treatment, you can clear it to 0. Okay. And M1 to M5, it's a memory function. You can set some parameter for different people, for people of different age, or for the same people who has done 5 times of the treatment. So it's easier. Fast model and slow model is the speed that when you are doing the treatment, the speed of the dots that you are doing. So use the fast model, you can reduce the treatment time. Slow model, it can be more safe. It depends. If you are professional, you can do the fast model, and if you are a new operator, it's better do the slow model. Start, stop, back. Start, when you press the start button, then you are prepared. You are very good, well prepared to do the treatment. Stop, then you stop the treatment. Back, you are going back to the principal interface. And the Vmax. Vmax, it's designed to complete the treatment, because some little area, some small area, like the nose, like around the eyes, and the forehead, because it's not the plain surface. So we must use the Vmax to make the treatment completely. It just shot 1 point every time. And there is the cartridge. The depth of the cartridge. You can see that on the cartridge. It's 3.0 millimeter. So on the interface of the machine, you must see 3.02. And the capacity is the life of this cartridge is 62,000 points, and the total that we can use is 917 points. Current is 0 because we haven't done the treatment yet. This 1 joule, 2 joule, or to 8 joule maximum, it's energy. The hertz 1 to 8 to is the frequency. It means the speed that is fast or slow. You are doing the treatment with this Vmax treatment head. Okay, this is 9 hertz. So when we are doing all the things prepared, you must apply the gel on the face. Okay. You must apply about 1 millimeter or 2 millimeter of the gel. For the multi-line treatment head firstly, then Vmax, and the depth from deeper like 4.5 to 3.0, then last time 1.5 millimeter. You must do the treatment from deeper to the superficial. Okay. Now we are doing the treatment with 20 lines and 300 points every time. And the power, we must do the test from the loudest power. Okay, I will do it from 0 to 0.5 joule and do it fast model. Start from the cheek. How do you feel? 感觉咋样？疼吗？
不疼。
So do you feel something? Feel anything? 有没有感觉？
没有。
Nothing felt. Okay. Okay, I will make it upper. 0.8. Let's start. Change another area to do the test. 现在呢？有没有感觉？
有一点。
A little? No pain. Pain?
有点大，有点大。
Pain. Little pain. Okay. 0.7. No, 现在呢？
还好。
Okay. So I will do the treatment with 0.7 joule.
好像再小一点。
可能。Okay. Okay. A little. When you are doing the treatment around the mouth, you must make the patient to how to say it? Push air into the face. I'll say it in English. So
let the skin far away from the tooth.
okay. OK， 好，还有演示吗？还有
4.5打1.1和3.0。
是。OK。
就这样的话还得3.0。
OK. Because today we are showing you how to do the machine. So when you are doing the real treatment for the patient, you must do the 4.5 firstly, by all the cheek, forehead, no, around the eyes, no, around the nose, no. With 4.5 millimeter, you can only do the treatment for the cheek or for the neck. Okay, then next 3.0 millimeter for the whole cheek, and for people who is a little strong, who has no fear to the pain, you can do the treatment for the forehead too. Okay, a little. Then 1.5 for the layer superdermis. You can do it for the whole face. Okay. Now I will show you how to do the treatment with VMAX. VMAX, stop, back. VMAX. Now I use the 3.0 millimeter the depth. I can do it for the treatment of wrinkle. For the wrinkle. Not so bugad. Start, and you must do the test too. Ask the patient how does he feel. 咋样？啥感觉？ How do you feel? Nothing? Okay. I can make it a little higher. Now, do you feel anything?
Nothing.
啊？疼了吗？
不疼。
And when you are doing the treatment for the eyes, you must extend the skin like this, or a little lower. Make the skin extended. A little pain. 能忍吗？ Okay. So now I will show you how to do the treatment with liposonic treatment head. If you are not so sure how to draw the lines on the belly, so you can take a treatment handle, treatment head. The umbilical is the center.
Belly button.
Belly button, the center. Then, oh, sorry. You can know how to draw the lines every time. Just two. Okay. Now this is the. Sorry. Excuse me. I'm very sorry, but I must do it. Sorry. I'm sorry. So you can see that the map is very clear now. When you are doing the treatment, you must apply gel too. Gel firstly. Sorry. select the liposonics, you can see that on the interface there are some parameters, but the only one that you can change is the energy. Take the energy, then with two arrows, upper or lower, and you click the upper, then energy will be a little higher. Then reduce lower fascia. Okay, change the energy like this, and this is how many points on the 1 centimeter, 1 centimeter quarter. How to say it? I don't know how to. You can make it. This is it means the density on the superficial of the skin. How many points that you shot? You can make it a little lower too. For the young people, you can make it with minus points. The maximum is 5,076 points, and then you can see that the machine makes the abdomen 9 parts with the belly button or the center. You can see that when we are doing the treatment on the center of the belly, it will automatically it won't short on the umbilical, on the belly button part. Just do the treatment on the around area. Then when you select it rightly, this is fast model, slow model, start and pause. The total number, it means that how many times that you can do the treatment with this cartridge. The most is 526 times you can click the work button. Okay, now start. Then when it starts to do the treatment, the loose will be blue. The light will be blue. How do you feel? You can see that the points are shorted under the skin quickly. The ultrasound with all the liposonics will do the function on the layer of the terra or adiposo to the fat layer. So it's used to do the to reduce the fat, to lose the weight, to make the body more beautiful, more slimmed, like this. So for another part, you just select it. Okay, also select it. Then put the treatment handle on this part. Start, then start. Okay. Then also select it. Select it. Also select it. Do the treatment on this, like this. Okay. The last two treatment head of this machine. For the treatment head of the vaginal. Okay. This with two tubes is the tester of the vaginal. Is to measure how tightness of the vaginal. Okay. When you need to measure the tightness of the patient's vagina, firstly we must do the disinfection work to use the yodel or the alcohol to do the disinfection of the vaginal. Then we must prepare the two contour. Okay. Put the contour on the head, on the tester head, then put it into the vaginal. then like measure the tension of the blood tension. You will pour air into this part. Okay. Then interface, you can see that it will show you the measure the tension with the unit of millimeter of Hg. Then when you can't blow air into the tester head, you can know that this is the tension, the tightness, hot tightness of the patient's vaginal. Then press save. This is the treatment. This is the tightness that we have measured of the patient's vaginal. Then you can know which treatment head of the vaginal that you must use. You can see that this is a treatment head. It also has different treatment depths. This is 4.5 millimeter for the SMAS layer, and this is 3.0 millimeter for the dermis layer. Normally we just use 2.5 and 3.0 millimeter to do the vaginal tightening treatment, because 1.5 millimeter it has no such important function like the skin tightening, skin lifting for the facial treatment. Okay, so when you do the real treatment, start from the deepest layer, 4.5 millimeter firstly. Then click the treatment option or the vaginal. Then you can see that the interface of the vaginal treatment head. This is the all treatment of the vaginal. You can see that it's a circle. The round normally is 315 degree. It's all the vaginal. So you can adjust it with these two buttons, minus or plus. When you need to do not the whole vaginal treatment, like some people, it just has one part of the vaginal have problem because of the pregnancy or because of trauma. So you must set it with this button. Okay, 115 degree for just one half of the vaginal. The angle, you can also change the parameter of the angle or the degree with plus or with the minus. It means between two lines of the treatment, how many degree that it turned, the treatment head turned. Normally we set it 5 degree or 10 degree. The length, treatment length, is there. 25 millimeter, just like the 4D multi-line. The length of the 4D multi-line is 25 millimeter too, and the pitch. Because the vaginal treatment, just this part, just short one lines at one time. So the pitch is the distance between two dots, 2 points on the same line. It can be changed with the minus or the plus button too. The power is easy. It's the energy of the ultrasound. We must do the test from the loudest power, 0.5 jar, 0.2 jar. And you can see that too. This is total line. This is 0. It means that actually we haven't done any lines of the treatment, so it's 0. After we this part we short one line, it will be 1. And the total, how to say it that it's 13.7, because now we set the degree, the round is 180, and the 5 degree of the angle. So totally it's 16 with 1 line, 1/4 line. So it's 37 lines. And auto, when you do the treatment of the vaginal tightening with auto model, it means that every time the treatment head turned 5 degree, and then it will short every lines by himself, by the treatment head himself automatically. If you don't use the auto model, so every time that the treatment head turn around 5 degree, it will be stop. It will stop to short the lines. You must press the button another time, 37 times, 37 lines. Then you need to press the button 37 times. Okay, and on the left lower corner, you can see that this is the information of the cartridge. The depth is 4.5 millimeter, and the total lines is 10,100 lines that it can short. And the residue, the rest lines is 129 lines. And here, start button and ready button. When you prepared, when the patient and the operator are, and the machine are all prepared to start the treatment, you must press ready firstly. Then the treatment head will turn 1 circle or 2 circles by himself to find the 0 lines. When only if the lines on the treatment head are all right here with a 0 number, so the light will be of the blue color. It means that the treatment can be started now. Then you press the start and the button. You must use gel too when you're doing the treatment. Okay. Then start the treatment. You can see that the gel will jumped. Okay. Now we are not using the auto model. So every time the treatment head turned 5 degree, I need to press another time the button. Okay, turned and stop. Then another time the button. Another time the button. Now we are using the auto model. Okay, click the auto. Then it will be the purple color. You can see that it will do the treatment by himself. Okay, by itself. Every time I don't need to press the button. It will be stopped after the 37 lines all shorted. You can see that the line will be changed. Every time it short 1 line, and here you can see that it's 12, 13, and 15. Okay. Okay, when you stopped, you must press the button firstly, then press the start. Ready? Okay, all stopped. Okay.
还有没了。
Hello everybody, this is Beijing St. Helen Company, and today we will introduce you how to do the treatment of the skin rejuvenation with this machine, 6-in-1/2, and it has one handpiece. It's named microneedling. You can see that it uses the technology of needling, radio frequency, and vacuum to do the treatment. That has different types of the treatment head. Today I will use the 25 needle, this treatment head to do the treatment with this patient. And we have different. You can see that this is a nano treatment head to help the absorption of the sustenance nutrition for the skin. And this is one-line treatment head to do the body parts like around the eyes, around the nose. And this is a big treatment head. It's to do the treatment for the body part. Okay, today I will show you how to do the treatment with these 25 needles to do the treatment on the face of the people. Okay, now let's learn something about the interface of this machine. Okay, sorry. You can see that there is on the interface of this machine, the last one is the microneedling interface. Then get into, you can see that on this screen, the left side, there is 2 letters. F means the face, B means the body. On the there is 2 work model, manual and auto. This is times. Times is how many times that you have done the treatment with this treatment head. Time is a time. Okay. Normally we set the treatment time as 1 hour or 30 minutes. Depth is the deep. How deep that you do the treatment under the skin. You let the microneedling enter into the skin. Speed, okay. Look at the unit. It's a second. So it means the time that the microneedling releases the energy or radio frequency under the skin. Suction, okay. Suction, the difference between these 2 models, manual model and auto model, is about this suction. With manual model, you can see that on the treatment handle there is a button. The manual model, the operator controls the microneedling with this button. Okay, it means that when you click this button, when you press this button, the manual model. Let's show you. Okay, with the manual model, the operator controls the microneedling with this button. Start. Then, when you press this button, the needling will be released out. Okay, this is manual model. It has nothing to do with the suction. You can see that suction can be 0, can be 1, can be 2 with a manual model. But with the auto model, when you do the treatment with auto model, the suction will be always of the level 2. It can't be changed. It means that when you use the auto model, the operator will be the machine. Okay. When it means that it must form a vacuum, then the needling can be released out. You can see that? Okay. It means that when you're doing the manual model, the operator controls the microneedling. But when you are doing the treatment with the auto model, the machine controls the microneedling. Okay? So it's easy. For the people who is not so professional, you can do it with the auto model. Okay. Manual model. The suction. So radio frequency, it means the energy or radio frequency. Normally, we use it from 16 to 18 on the face to do the face treatment. But when you are doing the treatment to the body, you can use it a little higher. Okay, the energy, radio frequency energy, no matter to do the treatment for face or for body, it starts from 10 watts and stop with the 115 watts. But the depth, when you are doing the treatment on the body, the depth will be deeper. Will be deeper to 3.5 millimeter. But to do the treatment of the face, it's only 2 millimeter. Okay. So another thing, with the body interface, you can see that there's a cartoon to show you how this machine, how this treatment handpiece to get the result. Okay, you can see that. Firstly, the needling enter under the skin, pinch the skin, and then release the radio frequency energy to stimulate the collagen and fiber to form the new texture of the skin, to help to do the wrinkle removal, scar removal, and concentrate the pore enlarged, make the skin more lisa, more beautiful, and to do the skin lightening, lifting. Okay, so now we are going to show you how to do the treatment. Firstly, we must make sure that the people can accept this treatment. People who can't accept this machine, this treatment, it includes women in pregnancy, women in the cycle of menstruation, people who has the hypertension, who has the diabetes, and who has the disease or heart disease like this, and who is very sensible. The skin is very sensible, and who has something like the cycle or has something in under the skin like Botox. You must do it after 8 months or 6 months. Okay, then clean the. After you make sure that this person can accept the treatment with microneedling, then clean the surface of the skin, apply the numbing gel. After 20 or 30 minutes, quit the numbing gel and do the disinfection, because it's a treatment invasive. Okay, so the needling enter under the skin. You must make sure that it's a disinfection skin, and then you can do the treatment. The hands and the treatment head must be disinfected. Okay, we must make sure the treatment is very safe. Then I will show you. I must make sure that so I will put the depth the minimum 1.2 millimeter to make sure that the microneedling won't pinch. Okay, it's manual model. I must press the button to do the treatment. How do you feel?
我换个角度。
在这个角度可以。
How do you feel? Okay. 疼吗？
有一点。
The patient maybe feel a little pain, but it's normal. It's because that we have many nerves on the subdermis and the dermis. We are doing the treatment around the eyes, then extend the skin with the hand.都没给你打破 ，OK 了吗？ Then I will show you how to do the treatment with auto model. That you may listen the sound of the vacuum of the air. You can see that the machine will control the needling and release them only when the machine checks the vacuum. The skin may leave a little redness and inflammation after the microneedling. It's normal. Don't be worried. How do you feel? 额头 on the forehead. You feel a little pain? Pain? 疼不疼? A little pain. So when you are doing the treatment, some area like around the eyes, around the nose, and on the forehead, maybe you should change it a little the depth, because the forehead and around the eyes, the skin there is very thin, is very thin. So you can reduce a little the depth or the energy. Come on.
有一点。
我吸不住了。疼？可以了吗？不打。好了。
好了。
可以停了。